get started, again, thank you so much for coming to the Harris County Medical Society event where you can learn more about how to promote yourself. Secrets to Promotion, as we know, is the title. So let's start out. We're just going to have the panel introduce themselves. I think as you'll quickly see, we've kind of got an all-star panel here. People that actually are in charge of promoting others or have been promoted themselves. So with that being said, we'll start with you, Dr. Balasubramanian. Go ahead.
Thank you. Yes. Hi, everyone. I'm Ashok Balasubramanian. I've been at Baylor College of Medicine as a faculty member for 35 years. I just found out. It just gave me a flack. Came as a shock, but I was also, a student and a trainee here before that. So I am an endocrinologist, but I think the reason I'm here is because for many years now I have served as the Vice President for Academic Integration, which basically means that any aspect of education or research as it relates to connecting our affiliated hospitals and now our affiliated health system into our academic fold, that's kind of what we do. So it includes a lot of things like faculty development, and I hope a lot of topics that you might find useful when we talk about your own careers and how you might want to get promoted. Great to meet you.
Good. Yeah, my name is John McCullers. I'm a pediatric infectious disease doc. Spent the last 28 years in Memphis, Tennessee. About half of that at St. Jude Children's Research Hospital as a basic translational science researcher studying influenza viruses. Then 13 years at our sister children's hospital, the Bonner Children's Hospital, University of Tennessee, as chair of pediatrics for 13 years. And I serve concurrently as senior executive associate dean of clinical affairs, so the number 2 in the College of Medicine for the last 5 years. I've been here in Houston for a year Monday as the vice president of health for the University of Houston and the dean of the Tillman J. Fertitta Family College of Medicine. So great to be here. I've been enjoying myself this year. It's been a lot of fun challenges, a lot of work, but it's been very gratifying, and happy to help out any way we can here tonight.
Great. Thank you.
So I feel like I'm probably the most inexperienced on this panel. So my name's Michelle Shen. So I am an assistant professor here at UT. So my specialty is breast surgery. So in the Department of General Surgery, but specialized in breast. So my path is a little different. So I trained here at UT Houston for general surgery fellowship at MD Anderson, and then was on faculty there, and then left for a community practice up in the East Coast, and then came back on. So I think what I probably contribute to this panel is kind of like more of a younger faculty and trying to navigate this promotion process. And so in an academic environment, and the difference being how you've been seasoned and then come back to an academic field. So heavily involved in the Sugar Land community. That's where my primary practice is, as an extension of UT.
My name is Kulvinder Bajwa. I'm part of the Department of Surgery as well here at UT Montgomery Medical School. I've been there since 2008, so coming up on about 17 years this year. And through that, I was just a community practice person, but then joined academics about 8 years into my practice. So since then, for lack of guidance and these kind of things, you have to kind of figure it out on your own. And so been promoted to professor about 3 years ago, and been serving on the UT Faculty Promotions Committee. And with their permission, they're like, yeah, go spread the word. It's not like a secret, but it's really something that everybody should, who is in a academic environment, should be thinking of their next level promotion, whether they do it or not, whether it takes them the 3 early years or whether it does everything. So anyway, so my perspective is navigating that process, being on the promotions committee, and trying to help other folks, just like has been mentioned, faculty development, faculty promotion, faculty advocacy, just to make sure that they take care of their own careers, because everybody's involved in their own careers. Give you a side note, I also served about 33 years in the military, and so I went from your basic boot camp recruit all the way up to colonel in the Army. So I know a little bit about promotion and navigating those ranks and what it takes to get there. So it's the actual promotion cycle. We look like we only have 3, but there are some other nuances for those 3. But there's also this military ranks, which also get a lot of attention of what you have to do to get rank and promotion. So there's some commonalities because it's a leadership cycle. As you move up, you not only get more leadership experience. So that's my perspective.
So just a couple of housekeeping rules before we get started. First off, we want this to be as interactive as possible. So if you have a question, please feel free to ask it. I have a list of some questions that have already been put together, but we can stray from those if you have a specific question. Also, we may have a couple of our panelists answer one of the questions, and they may not all answer it. If you have a question for a specific panelist, please don't hesitate from asking that panelist a question. So with that being said, let's start out. The first set of questions falls under the topic building a strong foundation. So let me ask the panel, what are the foundational steps early career scholars can take to set themselves up for successful promotion? We're talking about scholars.
I think if you mean scholars as far as people who, as the university, I'm sure the rest of the academic institutions define scholarly activity as something other than clinical activity. So there's clinical activity, there's scholarly activity, and then there's community service and university service. So these are kind of like different buckets of your CV that you have to develop. So for an early career scholarly person, obviously, if you've done it already, so two groups, right? So the people who did it in medical school, that's how they got the position that they got by making some faculty contact and then going into their research environment and then getting that residency position, then in their residency position, either taking an actual a year or two to do research or to take time out during their residency to do it kind of on their, as they went along. They obviously have some sort of research background. And then if they want to pursue that as an early career type of scholarly activity, definitely looking for some funding in this day and age is extremely important, or joining somebody who has some funding to give a partial FTE. So FTE is a full-time equivalent. So somebody says, I want to hire somebody, if you're not familiar with the term, takes X amount of dollars, say $100,000 as a full-time equivalent. You will say, okay, if I take time out of my practice or clinical practice and I can do 20% of this thing, they must have that funding for you to justify it. Otherwise, you're just doing it on your own as a self-promotion type of item, which happens a lot in addition to your contribution. So I think funding is a big deal. Obviously, interest. If you have no idea what you want to do, then that's a separate issue altogether. You got to see what you want to do. If there's a problem or question that you're plagued with in your clinical practice, that's the topic you want to pursue. And obviously now with ChatGPT and several Medline searches, it's much easier to data mine if there's already data out there that you will be repeating something, or do some sort of meta-analysis of what your problem should be, and then there's some gap missing that you want to pursue. So funding, topic of interest, and then some original work or analytic work, which is a lot more happens. You don't have to be the innovator of a brand new thing, but a new thought on a brand new thing is how most of the research actually, if you go to your national conferences, that gets presented. It looks from a different lens, from a different angle is how you do it. And then obviously work your departmental leadership into getting that presented into divisional or departmental presentations, ask them to get you into meetings and submitting those kind of abstracts as mid-work abstracts, final work abstracts, and that develops more. And I think that is what the early scholars program would be, to point you in the right direction, to put you on your step work so you can build that portfolio for that next step of promotion.
If we're thinking about the foundational pieces, to me, there's a few things you need to think about. One is your area. And I would go beyond just what's your interest into what is your niche. So are you doing research, and there's many different flavors of research. So which flavor? Are you doing something like quality improvement? Is that what you're going to do? Are you in curriculum development? Are you doing other academic? There's all sorts of different academic contributions you can make. So what is it that you like to do, and where is that going to be focused? I think is one of the things. And you can explore different areas by finding, work with somebody on this thing, work with somebody on something else. that they're interested in, and see if it's kind of, you like that and want to do that or branch off into that. So that's the first thing I would think about. The second is mentorship, and I'm sure we'll touch on this a little bit later about the importance of mentorship. Incredibly important to have a mentor and an advocate. And I always talk about having two mentors, at least. One of them should be within your discipline. So if you're in emergency medicine, somebody within emergency medicine who knows that specialty. And then often that's the division chief or another leader in the division, or sometimes it's just a senior person within that department or that division. And then the second one should be somebody external. So in a different department entirely, or at the different institution where they are, know something about your, particular area that you're interested in. What is that niche that you're in? You're looking at, okay, well, let's find somebody through, and work through some contacts to get somebody who you can talk to about that and let you know the ropes. And then the third sort of basic building block, I would say, is secondary training. And so none of this stuff is easy, but there are workshops you can go to help with, quality improvement or research or writing grants or education. You can get masters of education or public health or epidemiology or a half a dozen other things, bioethics. There's all sorts of stuff that you can do that's going to provide education and provide a basis and help you find mentors as well through that. There are other ways to do this with online courses. There's leadership courses. There's so many different things you can use to improve yourself that shows, if you're talking to your chair about wanting some protected time, what is the value proposition you bring? And value propositions, I've done my MPH, I've got this project I want to work on, it's going to benefit the department in this way. Can I have some time to work on this? A lot of research is outside the hours that you work, but some of it can be within if you have that correct value proposition.
Yeah, I agree with all these ideas, but I think that it's important to find some structure fairly early. And the experience I have is with my own institution. So at Baylor, when someone comes in typically as a young assistant professor, they're already in one of three tracks. So you're either in kind of the clinical research track, or you're in the clinical education track, or you're more recently a new track, which is like the pure clinician track. And the sort of milestones for promotion are different for each of those. But there are some common things that run across all of them. So the milestones for promotion on the research track, are fairly established, for decades. I mean, you have to prove yourself in research, and which means you have to get funding, which means you have to apply for grants, and you have to generate papers and so on and so forth. And that's kind of the coin of the realm in terms of how you go forward. With clinical education, it's a bit, everybody educates people within, an academic setting, but you have to sort of acquire more of a leadership quality there. Right? You have to be, start off as an assistant program director of your specialty, then work up to being a program director perhaps, or develop a specialized clinic where the training of the residents or students or fellows imparts something new. And in the pure clinical track, you just really have to excel as a clinician in terms of productivity and also in doing something new in that area. Now, the common thread through all of this is you have to have scholarship. So the nature of the scholarship for the research track, again, pretty obvious. It's based on the research you do. The nature of the scholarship within the education track is a combination of, helping trainees develop a theme from their clinical work and publishing it, or developing something special yourself, particularly in the areas of quality of care, patient safety, that sort of thing. But it has to have an education part of it, and it really helps to get some training. It helps to get a master's degree. It helps to have an MPH, something which will give you the skills to be able to do that kind of education-based research. And then a pure clinical track, I think that it's hard for a pure clinician who's trying to meet productivity standards these days to also be doing scholarly work. But if you want to get promoted, that's an expectation. So you might then again want to work a little bit more like that second track, find an area of quality improvement, and work with trainees and others to do something in your own line of work that might show an improvement in quality and publish it. So scholarly activity publication runs across all of them, but the kind of background to that is different. And you really need faculty development for that. People don't come in fresh out of residency or fellowship knowing all these things. So, we're fortunate at Baylor, we have really excellent faculty development office, and they will actually come and meet every new faculty member and start talking about how they ought to be lined up. So, or you can get that help from others, like as Dr. McCullough said, your program director or your chair and so on.
All right. What are some effective strategies for building a strong publication record beyond simply publishing in high impact journals?
So, as was said, manuscripts are often thought about the product of research, and getting promoted in a research track or getting promoted based on your research is typically about publications, presentations, and grants. And the grants are probably the most important, but quality publications. Right now, we are firmly into an era and are moving toward that where a lot of research now is team science. And it's no longer the solo researcher who has a grad student and applies for grants and does that solo thing. It's bigger. It's bigger projects. It's many people working together, and that's a good way, particularly if you're a clinician and doing some of that work, to get on these publications. And you can get promoted just on the base of collaborative science, where you're part of a team and you're doing that work, and you're some piece of that work that is identifiable. You can say, this was my role on this study, and putting out a number of publications that are, and every institution has a little bit different sort of guidelines or traditions about how many publications and what's the quality of the publications. Certainly if you're publishing the super high impact stuff, then the rest of it probably doesn't matter. But if you're publishing team science and you're a middle author, or occasionally the co-first author or something on these publications, you can amass something there that helps you toward publications. And then if you're going to be sort of that solo researcher, the kind of old traditional way of looking at it, like when I came up, then you probably need the faculty development piece. You need to have a career, a mentored career development award, a K award, or some other sort of career development award from a society. Say, there's a lot of these out there where you can develop those skills, because it's not easy to do. You need a lot of mentoring and tutoring to do that, as opposed to learning it through the lens of being a team member and taking on more and more responsibility and eventually leading a team doing team science in that way. So that's another way I would think about it.
I think that's very well said. I think I'm a product of team science. I mean, just going from clinical and doing heavy clinical work, the strength in that is you're into that niche, or you're doing the same thing. My example is surgery. We do hundreds of gallbladders, right? So if you want to do one piece of that thing, you can definitely get enough power in your study to do that. But definitely it's single surgeon, that sort of thing. So if you collaborate through the department, we have 70 some odd surgeons, pretty soon you have a very good data set, right? So definitely this team science approach. Your medical students are always looking for a project. Your in-between first and second year people are always looking for some project. Your residents are always looking for some projects. So different people can attempt that work, but just like it said, is depends on what your role is. If you're the anchor study, you're the person doing the clinical work, then you've got to put yourself in that position where you're not writing the paper, you're not first or second author, but maybe you can be anchor author, because that's the responsibility that you have, especially when you go and present and you present this data. You must know that data set. When you do team science and you put your name on the thing, you better know what you're talking about when you go. Otherwise, people put their names on it, and we ask people who are medical students and residents about these papers, and they're blank space. Does not look good, right? So make sure if you're team science in it, you better know your research piece. I can't tell you how many times we've done that. We're in interviews, you ask somebody about something that they put there on a CV, and you get a blank space. And like, that's not good for them. So I think that's definitely a good notional thing to do, is make sure that you definitely have this team approach or protected time. We also have in this range, I just wanted to mention off my head, but in pure clinical stuff now, I think most of the institutions I saw are on Epic, but there's other medical records. Epic has a great research data and analytics tool that you can do no matter what specialties you should do. So again, if you take an interest, you can data mine this thing with the help of some of the people that are on those analytic teams. And if you want something analyzed, they can help you. If you can't, there's online, you can send Epic some sort of query and they will help you do that research for you, including a whole host of registries in every single specialty, because every single specialty has some sort of registry, some sort of certification. So that goes back to the quality, safety, improvement, and efficacy of your medicines or your techniques. There's all kinds of things in societies about now program algorithms for your treatment algorithms, and those kind of things are there. So there is definitely opportunities on all of those pathways that Dr. Balsavimaya mentioned about the pure clinician trying to do that work, or a little bit of a hybrid of clinical and clinical education, because you're trying to take that algorithm and then put it into practice. So that's a good little thing to do. And then the educator, don't be shy to, as soon as you come out here early, teach medical students, become their clerkship director, become their sponsor. If you truly are guiding somebody through a career path, whether it be a medical student, a college student, or a resident, then you should put that in your CV as a true mentorship. Instead of just they rotated with you, that's not what we're talking about. We're talking about true mentorship through their career. That's a good, they do look at how many people you mentor, because the research track people show how many people these people mentor to get their achievements.
All right, next question. Explain the component of service in the promotional process. What are the institutional expectations of this component? Dr. Shen, you want to start with this?
Sure. So I'm probably going to be in the more clinician track. So I'm 100% clinical. So I have no desire. Research is important. I'll preface by saying that, but I do not. I have no interest in research in terms of doing it. Bench research. I think it's important, but so when you first get hired on, you definitely meet with faculty development. There's a lot of seminars available to kind of help you start your thought process in terms of the promotion track. So in terms of service, it's pretty much your contribution to the university. Okay, so like how are you involved in education, specifically the medical students, the residents, and what is your role? The second one is service to the community. So what are you doing as part of a contribution to the community? So for University of Texas, we are affiliated with Memorial Hermann. So there's a lot of committees, a lot of opportunities where you can serve. So that counts into effect as well. And then the other part of it is just development of your practice in the community. Like how are you growing and how you're establishing the UT presence in the community and trying to incorporate into it. So it's a lot. I'm not gonna lie. When you first start off, you're trying to establish yourself, and especially if you are just finishing residency, you are also just trying to get your feet wet. Like you're now no longer a resident, so you don't have someone looking over your shoulder. So you are now responsible for these patients, and you're also just learning what to do and how you want your practice. So I feel like the first year or two is really challenging trying to juggle all these balls. And so I think it took me, like, even though I've been in practice for a while, but coming back into a more academic setting, it took me a year or two before I started getting more involved in the medical school in terms of like medical student coaching and resident teaching. So for us, one of our goals is to develop a breast fellowship. So that's one of our 5-year goals in our breast department. So I think that's also a contribution to university.
I just wanted to add something to that. I think those were great points, but particularly addressing the people who are pure clinicians, which is what you were aiming at. I think it's really great and important to get that early advice from somebody in faculty development or faculty affairs and start developing a portfolio. I'm not sure how it is with the other institutions, but there is a very kind of intentional portfolio development plan that is advised and is set up, there. And that includes, how would you record your teaching? How you would kind of go about recording your presentations and whatever it is, your interactions. And then, what is kind of a minimal number of publications that might qualify you to, to sort of present yourself for promotion and things like that. And that's really important because we have all sorts of different specialties. And I'll just give you one example. We found that our hospitalists, really felt stranded, because they're on shifts. They're on for 4 days and then off for 3 days and back on for 4 days. So number one, they felt discontinuous. Secondly, even though they belonged to a department, medicine or pediatrics or whatever it was, they didn't feel like they were completely involved in that, and they were sort of out of touch with what was going on. And the times that they're on, they're working all the time. So where is the time to sort of develop a quality program or start a database or whatever? So, but it can be done. So we actually spent a lot of time working with the hospitalists to figure out how they might be able to develop the portfolio. But that sort of framework of thinking, I just don't, I won't just teach a student who happens to be posted with me, but I will develop this in a very structured way. It's a good thing to start that very early. And then I think if you do it right, no matter what specialty you're in, you can show productivity in that area.
All right, the next section, long-term career planning. So how can junior faculty members strategically plan their career trajectory to align with promotion expectations?
Yeah, so when I think about promotion, I think about it as sort of a narrative arc. What do I mean by that? So our faculty put in effort in these different domains: clinical, research, service, teaching, training, and so on. And so what I want to ask is, what is the product of that effort? So if you have research effort, what is the product of that? We traditionally think about that as a manuscript, right? But if you're in the other domains, what is the product? Is it curriculum development? If you're developing a breast fellowship, that's a product. I developed the breast fellowship, right? And when you think about all those products, how do you describe that narrative arc where you started at A, where you were a new assistant professor, and now you're at B when you're ready to become an associate professor? Can you tell me what your effort was and what the products of that effort were that justify you for promotion? Then the third element of it to me is recognition. So external recognition for yourself, the department, the college, the university, the hospital, whatever the case may be. And so does that product of your effort mean you're being invited to give a seminar somewhere? Are you being asked to sit on a committee in your subspecialty society? Are you being asked to help write guidelines either locally or regionally or at the national level because you're an expert as proven by this product of the academic effort you put in? And when you can bring those three elements to me, this is what I do, this is what I've done the last 5 years, this is what it resulted in, and this is how it's bringing recognition, and so you know that it's valuable, then to me you're ready for promotion. So that's how I frame it when I talk to people. I say the second element for this is always be tracking this. Okay, it's not like you get to your 5th year, you're like, okay, I need to think about promotion. You should be having this discussion every year with whoever you report to, whether that's your chair or a chief or somebody else. Am I on track for promotion in my 2nd year, okay, or in my 3rd year, or I want to go up in my 5th year, be promoted in my 6th year. What do I have to do to get there? You should be talking about this with your mentor, so it should be very purposeful. You should be developing that portfolio that was talked about in a very conscious way to document this narrative arc. So at the end, you can show why you deserve to be promoted.
So Sean, so good way to do it, and I'm not sure everybody should have some sort of system where UTS every end of the fiscal year we get an annual faculty evaluation, right? So I don't know if Baylor does it or any other institutions, but annual faculty evaluation is a good way because at that point I have to submit my CV. So that's a good way for me to update my CV if I haven't thought about it until then. So at least at that time I save it as of that date. So there are some formats for your specific institutions of how they want that CV done. So make sure if you haven't done it, you please do it according to your academic institution's requirements. and format it through. Mine is actually public knowledge, so you can go on the YouTube faculty, my CVs on my faculty page. So, and make sure that it is actually uploaded by your person. So my faculty, sometimes the CV's old, and I'm like, listen, this is from like 2023, but I know I've turned mine in. So make sure that you're updated with anything significant you do. It's very hard. You do something and then life gets very busy, but at that point, at least for those things. The other thing I would tell you is that I applied. So at my level, things come up. We get emailed. There's this vice dean position, and this position, that position. I apply for these. Those are great opportunities for me to consolidate my career path. And you can do that at a lower level when if there's some things that your institution is advertising that they need help at this leadership structure. It can be low, it can be high. But don't be shy to apply. Let somebody tell you if you're not qualified, but that's a great way for you to structure your CV, put it in there, and when they tell you you're missing this data set, that's a great way to know that that's what your aspirational level is. So that's the other way that I would tell you, don't be shy about just hitting those benchmarks inside your department, inside of the institution, even outside through your specialty societies. They're looking for something. Like I just got a thing about, hey, we identified you because I served in some committee, but I'm nominating a committee at this Society of American Gastroendoscopic Surgeons. Why not send their CV? Then what do they say? Send your CV. Okay, I gotta sit here and I gotta update it and I gotta date it as of August, right? Because September 15th is the deadline for them. So those are the great opportunities that I choose when I do apply for those things, to update my CV every time as I go, to take a look back and saying, what have I done since the last update? Include it in there. And I tell my children that they're undergrads to law schools, just keep doing it. And it's very hard. It's very hard to capture everything. You have to look back in your own memory to do it, but those are great little items. And then I would tell you, look on your websites or ask your chairman or chairperson or division chief to look at their CV and see what is their career path then. Not that you want to follow the same thing, but just look at somebody else's trajectory. That's the faculty development. That's the actual mentoring that you can do. You don't have to mirror it, but if you want to follow in their footsteps, then obviously you've got big shoes to fill. But those are kind of the critical items that you need in order to pursue those echelons. And the third thing I would tell you, in military, low-level promotions are 3 years. High-level promotions are exactly the same. Minimum 5 years. You can go below zone, or you can go on track. 5th year, go for the promotion cycle. 6th year, you get promoted. Almost exactly the same. It's something about those 5 years that people say it takes that long for you to accept the next level of responsibility.
How can individuals cultivate a robust network that provides support and collaboration throughout their academic careers?
I think it goes back to what Dr. McCullers was saying in terms of your trajectory. I think it's kind of like applying to med school or college again, how well-rounded you are in terms of, so you're trying to make a very robust CV. So I think when you're first starting out, becoming involved in your societies, and starting to look for opportunities, like on committees. I think that's a great way to start networking with people who are in your same field, and being able to, seek their advice as well, because everyone, I think the academic institution is pretty much same regardless like what state you are. Like the pathways are all pretty similar. So I think that's a great way to meet people of different levels, like at the assistant, associate, or full professor, or even chairman level. So I think nationwide going to those meetings are very good places to network, and also be able to challenge yourself as well too, and becoming more established, in that community where you are practicing. Locally wise, I think, having great mentorship within your department. So like for me, like our director will always constantly be telling us, these are opportunities. These will like look good on your CV. This is good for, faculty promotions as well too. And just starting to kind of be more established in your department, but also in the institution you're at the medical school. So starting to be on committees, starting to network with different departments, and getting to know people, and developing, different programs if needed. And I think, and then in the community, definitely is kind of integrating yourself with whatever hospital system that you're in, as well too.
All right. the next section is navigating the promotion process. Again, if you have a question, please feel free to ask it. But they're sharing a lot of wonderful information. So first question out of the gate, what are some of the biggest challenges academics face when seeking promotion, and how can they be overcome?
I think one of the biggest challenges is being disorganized. Because I think inevitably, everyone out here, if you're part of an academic institution or a teaching hospital, you're doing a lot of things. I'm sure there's nobody here that isn't on a couple of committees, who isn't teaching a medical student, who doesn't have residents on them, who hasn't written an abstract. But, as has been said a couple of times, developing that in a very structured way, right? Having feedback every 6 months or a year from someone who is watching over you, right? And ideally, that is somebody, it's your section chief or your chair, someone like that, and putting it all together so that it's you can see the accumulation of all of your accomplishments. That's really important. What often happens is that, particularly with clinicians, you get really busy with what you're doing. You're working really hard. Then 5 years go by, and all of a sudden you say, "Hey, do I need to get promoted?" Or you go to ask your chair, and they say, "Well, what have you done?" You know. And if you haven't kept a record of that, or not just keeping, it's not just record keeping, it's also being a little proactive about what you do. If you're a clinician in a certain specialty, you get rewarded for seeing hitting whatever the 75th percentile of the average RVUs or whatever it is. But have you noticed something that could be improved in your unit? Have you taken the initiative to say, maybe I can do a quality of care project around that, improve it? Can I show something, right? Can I improve my own patient satisfaction? Have I documented? So it's that sort of thinking, I think, which then gets translated onto your CV or your portfolio, which is important. So I think organizing your mind around those things is very important. If you're a researcher, those things happen naturally, because you know that you have to finish an experiment, you have to write a report, you have to send an abstract. But if you're not always doing that, particularly in the clinician track, it's important, I think, to be your advocate and to be very proactive about how you demonstrate your special skills.
I think the ones that I see fail is almost always unrealistic expectations. So somebody thinks they're ready to go up early, and they're not, and they don't make it past one of the promotion and tenure committees. Somebody who thinks their CV is more robust than it really is, that maybe they published a bunch of things in non-peer reviewed form that were self-submissions to an e-zine or something. They think that counts and should, the fact that they have 8 of those means they should get promoted. And maybe that's not the standards of that university. And so, again, it comes back to that mentorship piece and that regular checking in on your progress and having somebody who can tell you, no, you still have to accomplish this and this and this to be ready for promotion, and taking that advice. Like I said, the ones that have been problematic are just those who kind of go ahead with it anyway, like, oh, I'll just try and see what happens. And now the committee looks at you and they remember that 2 years later when you come back again, and the bar's a little higher because they're like, oh, this person, is thinks they're, is inflated thinking about themselves.
I think the challenge is getting that, putting your packet up and then being told, sort of like, for assistant, you should be on these committees, like Dr. Shen said. Get involved early. They expect you to lead a committee or a local or regional committee at about the associate level. If you're pure clinician, or even if you're a researcher and there's some national discipline type of conference that you're doing. And then to go up for professor, they really want you to be either coming into a leadership position for that entire either association or somewhere in the leadership structure, right? So you don't have to head it, but be on the executive board or somewhere where you're doing meaningful executive work for them. And that's to be told that at your 5-year when you're did your promotion package, you should have some leadership here. Now, when that track started, that's the challenge. 3 years ago, 4 years ago, you should have served 2 years in that committee, and this position requires 2 years of committee involvement, 2 years of this involvement, 2 years, and now you're 6 years behind. So I think learning late is definitely a big challenge. I think that's the part where sitting down and the clock resets when you do get promoted. So sitting down very early instead of saying, okay, I got some time before my next sit down with somebody. I think that's probably the challenge of comfort. Sit down early and speak with them to see this trajectory involves a multi-year commitment trajectory that Dr. McCullers exactly talked about, and making sure that you pick that up at the first year or the second year so you can slowly make that pack it up instead of realizing or doing it or getting involved a little bit later. And then the other challenge is not doing anything. So like has been mentioned, scholarly activity, community service, clinical education, those kind of things. You got to be really strong in at least 3 of those disciplines. So don't just flail on everything. You'll never make your points. We have a point system, at least for the clinical tracks. If you are strong in one thing, so that's at least a saving grace. If you're completely clinical, you hit your RVUs, that goes on the thing. I've been doing so much clinical service. I've had so much of this productivity. Then I've got medical students that I teach through this clinical activity. And not only do I teach them, but I mentor them. I do extra projects with them, and I develop curriculum with them. That's truly teaching. Another thing is just your job. You can't take credit for just your job. It'll score as a 0 or 1. And so you have to show some things in 3 basic disciplines of those 5 points that we try to stress to people that this is not just doing your job, and since you have time in it, you're going to get promoted. You have to show that you are up for this graduated or escalating responsibility.
All right, this one really strikes to the title of this presentation, Secrets to Promotion. Next question, what are the unspoken or unwritten expectations for promotion that academics should be aware of beyond the formal criteria?
I mean, I think I touched on it a little bit earlier, but you can build up your CV in all these little ways in all these different areas, but what is the value of that effort you're doing and that product that you've created? And sometimes the chair or the promotion committee or the university will value some things and maybe not value some other things. And you have to understand that perspective and say, what is it that my chair is looking for in me? What is it that I can do that will get me to promotion, or maybe this other thing in this particular department or because of the rules of this particular university are not going to get me to promotion where they might at another place. So I think that's one of the hidden things that you don't think about. You need to understand. Again, that's talking to your mentor, understanding the culture, understanding, or talking directly to the chair and say, hey, is this going to get me promoted or not? And taking that advice.
Yeah, I think another sort of hidden secret about this is the role of the head of your department in doing this. So it may be different in different institutions, but typically your department has a promotion committee, and if you pass that bar, you'll put your name up for the university or the college's promotion committee, and then your chairman goes and presents that to the to the university committee, and sort of defends you, tries to show why you should be promoted. And it's only at that level you actually get promoted. The reason I'm saying that is because your chairman or chairperson, I'm sorry, has a huge interest in making sure you get promoted, because actually they get points for how many people they've meritoriously promoted. If a chair is not promoting people, it means they're not doing their job. That means they don't have anybody worth anything in their department. Nobody wants to be known for that. So they have an active interest in your promotion, A, because they want to have a solid department, B, because they have to defend you credibly at the university level. So meeting with that person, right, getting to sort of ask them, how do I provide the value to the department, okay? So, I'm a very busy clinician. How can I do it? They'll suggest many, many ways that you could do that. They might say, hey, listen, I've been thinking that we need to create a little subspecialty here, or we need something to improve our workflow. Would you be in charge of that? Or would you like to create, a new test we can develop, that sort of thing. So talking to them, so you're aligned with the values of your department. And if that happens, then they're really going to push for you when you go to the university level. So I think, understanding that relationship is quite important.
And the other side of that coin is they don't want to put you up and have you fail, because then that looks bad for them as, as bad as it does for you. Okay, so
The other thing is to just find colleagues of yours who have just gone through the promotions process and see, what they've done, and they will give you a lot of advice in terms of, hey, this is what I should have done, a lot earlier. And so I think being in touch with people who have, in your group or in the institution who have gone through it is very helpful too. Because they'll tell you, hey, you might want to join this committee, or hey, you might want to do this.
I'll tell you the other hidden secret is being part of the faculty promotion committee. Your specialty is representative on there, but they're recused to eliminate bias. So when your file comes up, your colleague in that department has got zero say, at least on the UT side. So the faculty committee is all professor level people. There's PhD people, there's PhD clinician researchers, there's MD clinician researchers, there's MD straight clinicians like myself on there. But a department of surgery person comes, they put you out of the Zoom. You're no longer able to support it, speak to it, do anything. So the packet has to speak for itself. So that work is done before it goes to that. So they're reading the chairperson's letter, they're reading your recommendation letters, they're reading your internal letters, external letters. Dr. McCullers brought that up a long time ago. The hidden secret is you have a great report here, but what are other people outside of this institution saying about you? And it can be here locally, maybe for your assistant to associate. There you got, Texas Children's talks to the Herman Children's people, and MD Anderson. That's all fantastic, but then when you go up to professor level, somebody outside of the state needs to be talking about you. You have to have some national acclaim, whether it's from your association with them through your work is what they're looking for, not somebody you trained with, not somebody that trained you, but somebody that is knowing your skill set and your work and part of your efforts in getting up to that positional level. So establish contacts outside. And again, don't start that too late, right? So attend conferences. Sometimes you don't get time. Sometimes there's no funding, but try to get out to a national committee. Try to get out to abstract. Try to socialize into other folks that know you, that are going to know about your work. When you look it up and say, hey, listen, I'm going up. Will you be able to support me through that process? Can I send you a letter? That's the kind of relationships you need to develop early and keep those relationships, because guess what? I used like 2 of the same people or 3 of the same people that I got letters from for assistant to associate, from associate to professor, right? Because they had been promoted and they were in leadership positions. And so they knew my work all the way through. They knew what I was doing in my leadership positions that I had to undertake. And so never refuse a network. Somebody I served with in Iraq was the thoracic fellowship director who knew about my work, and from Mass General. Hey man, you want to write me a letter? And he's like, yeah, sure, I'd like to write a letter. So network early, network often, network outside of your comfort space, network outside of your home place. That is really important. At least what I tell you, these people are talking about. There's people international when we get our researcher letters for PhD folks. Their work is from international. I mean, that's really important. And so that's the kind of stuff that's going to get you promoted, because they know about your work. National, international acclaim, that's fantastic. That brings the university to life. It highlights you, it highlights your university, it highlights your work. That's very important. Those are the kind of things when you write your personal statement that is not a rehash of your CV, that you put it on there that I do this, and may not be captured in these things, but this is why you should consider me for promotion as well. So we read those. Believe it or not, we read every single part of that. Maybe not scan all of your pages and pages of your CV, but look at go through your H index, get a Google Scholar account, do all those other things that is important if you want people to look at your publications. The chairman mentions your H index, your I index. I mean, they're looking at these things. I'm sure they didn't get it themselves. So if you forward that data to them, they put it in their letter. So those kind of things have to be a very progressive type of career track and trajectory, you have to collate that data and then present to it. So those are the secrets that you have to be your own advocate, but you have to be talking the language of the promotion type of narrative.
Got just a few minutes left, a couple questions left, so we'll go through them quickly. But what are some common pitfalls to avoid during the application process?
I mean, follow the guidelines. Not following the guidelines will, get you in trouble. You make sure your CV is formatted the proper way. Make sure you've turned in your materials. Make sure you're not being unrealistic about your chances of getting up there, and it'll go through. And if you fail to do any of those steps, then you're going to get snagged.
I would say socialize your CV, your personal statement, with somebody. If you trust them, that's a good little way for them to go over your CV and critique it. Take all the critiques, take it humbly. You may not incorporate it, but take it humbly. They've seen other people's CVs, so don't just put your eyes onto it thinking you're perfect, because you don't know what you don't know.
Let's say you go up for promotion, doesn't work out. What are some things you can do to handle those setbacks or rejections, and how can you learn from those experiences and, in essence, come back later to be promoted?
Yeah, so there should be someone. So first of all, mentors, your chair. Talk to the head of the promotion and tenure committee, right? So that's probably the person who's most expert on the process and will know why you didn't make it through, and listen to what they say. And again, this comes back to, I think sometimes we overvalue things that we are proud of and we think we did, and that maybe aren't valued by the committee that year, or maybe aren't valued by the university as much as something else. And it may depend on the type of if you're at a research intensive university, they're going to value research over some other things. And if you're not, they may value the educational piece more in that case. And so understanding that, being humble, going back and asking, and then doing what they say. And typically you go up for promotion and you don't make it, unless there was one easily identified thing that you can fix. You usually don't go up the next year. You give it another cycle to prove it and get it out of their memory a little bit, because they remember you failed last year. They're going to have a higher bar for you.
There's much more of a system now than there used to be even 5 or 10 years ago. And honestly, all the things we were talking about before, in terms of planning ahead, the recording, the portfolio, talking every 6 to 12 months with your immediate administrative superior, whether it's section chief or chairman, keeping in touch with the chairman, all that kind of stuff. If you've been doing all those things, then you naturally would have built up the right portfolio that you shouldn't be turned down, right? So if you've been turned down, it must be because you didn't do something along those lines, and you kind of have to go back and sort of check and repeat those things. It's things are much more, I think, stratified and organized and kind of protocolized these days than they used to be. So again, speaking with your faculty development person and your section chief, your chairman early, figuring out what that protocol is, and then try to live up to it would be the best thing to avoid failure.
Dr. McCullers, you thought to be a great reason to ask this question, so I'll ask it to you. How can academics position themselves to thrive in a rapidly evolving academic landscape, embracing new technologies and interdisciplinary collaborations?
Yeah, so I touched on it a little bit earlier. I think we're rapidly moving into a little different era than when I came up through the ranks, and that is the era of team science, of interprofessional science, interprofessional education and activities. I think people need to be facile at operating in that environment these days, and because that's more and more what we're going to see as you go up for promotion and as you advance your career. So that's one area. I also think AI is going to make a huge difference across many different areas of academia. It's going to make a big difference in the clinic and freeing us from some of the EHR drudgery. It's going to make a big difference in research. It's going to make a big difference in pedagogy, and in a lot of the administrivia that we have to deal with, writing letters and doing assessments and giving feedback. AI is going to be helpful in all that. And so those of you who can embrace that early and get ahead of the curve and help be part of that transformation, I think are going to benefit from it.
All right, we're going to start with Dr. Bajwa. This is the last question. I encourage you, though, if you have a question, I'm sure all of our panelists are more than willing to stay after. We don't have to stay in this room. We can go back to the room where there's food and beverages and enjoy the conversation there. But our last question, at least formal question for this evening, if there's one key takeaway you want every audience member to leave with, what would it be as far as secrets to promotion? Dr. Bajwa.
I think probably I would tell you that I say one thing would be the external thing that I talked about. Because I think we forget that external component. And it's probably the hardest one that probably I would say that we have to obtain or can obtain is this external contacts of somebody that you're either collaborators, co-authors, co-study. So shoot for those if you are not available for a study with those. If you're just pure clinician, and definitely some committee involvement in those societies and making contact with them so they know about your work, they know what you do, how you do it, and talk about it, and they're able to support you in that realm. And I think that's probably, I would say, that one sort of secret that everybody forgets, because everything else here is in the local level. So I think that'd be the one secret I would say you should definitely pay attention.
Dr. Shen, key takeaway for tonight?
Probably mentorship, to really, get a great relationship with your section chief, and then your colleagues, people who you trust, to really, not, help guide you at the unofficial level of kind of guiding you, because those who are senior ahead of you have, I think they have more experience, but they have more exposure, so they have opportunities for you as well that they can guide you to becoming better in networking and establishing these relationships with other people.
And to me, I'll say just the structure, organization of your academic career. This is not something you start in year 4 and expect to be promoted in year 5. This is something you need to, every 6 to 12 months, be working with your mentor, working with your chair, and building that CV over time in a very organized fashion. You can't just be done all at once. It is a body of work that you need to be able to present.
I think, the wonderful points, all of them are very sort of practical and operational. I think the thing I would want to add to that is that it really helps if you love what you're doing. I mean, so.
This is why he's going last, all right? Bring it home.
In other words, if you're all in an academic environment, it must be because you either love research and learning something new, or you love to teach or educate, or you love to practice in a way that's always pushing the boundaries of the quality of care. If you don't want to do any of those things, then forcing yourself to check off all these boxes is sort of pointless. So the initial assumption is that you're there because you love this. And honestly, if you love it enough, all of this won't be a chore. Okay. So, I think try to be happy with what you're doing and hope that the promotion will get you happiness, would be a good motivator.
Of course. Just a real quick announcement before we close things down here. We had 2 of our executive board members enter the room when we got started. So one is Dr. Broussard, Dr. Dwayne Broussard. He's our Harris County Medical Society president. So afterward, please feel free to go out and talk to him. The other is Dr. Henderson, who is our Houston Academy of Medicine president. So they're joining us, and they'll be available for questions too. To put a bow on this, not only do I want to introduce them, but Harris County Medical Society, Houston Academy of Medicine have great opportunities for you to network with physicians, leaders, people like you see on this panel. They come to our events, so please get involved. You don't have to come to an event like this to learn about promotions. You can come to any of our events, and our physicians are always more than willing to talk to, up and coming physicians, those in academia, about what you can do to, advance in your career and get promoted, etc. So with that in mind, we also have a new certificate in leadership that we just launched this year. So if you want to look into that on how you become a leader and get certified through Harris County Medical Society, and we have a lot of leadership opportunities at both Harris County Medical Society level and the Texas Medical Association level. So with that being, there's information on that in the other room. There's also, again, food and beverage in the other room. So you got 2 birds with 1 stone, as they say. But with that being said, on behalf of myself, Sean Murphy, CEO of Harris County Medical Society, and my wonderful team, and you'll see some of them here tonight, to plan this great event, and Dr. Harani, whose idea it was to have a panel like this, we want to thank you for coming. Thank you for your time. We've kept it to an hour.